Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating study comparing two methods of collecting cerebrospinal fluid, or CSF, from South American camelids, specifically llamas and alpacas. As many of you know, analyzing CSF is a critical tool in veterinary medicine, helping to diagnose, guide treatment, and predict the outcome of diseases affecting the central nervous system in animals. A normal CSF sample should ideally be free of red blood cells. However, it is quite common for samples to become contaminated with blood during the collection process, a phenomenon known as iatrogenic blood contamination. This contamination can unfortunately make it difficult to accurately interpret the results because the presence of red blood cells can artificially elevate the measured levels of total protein and the count of total nucleated cells in the sample. Currently, veterinarians typically collect CSF from South American camelids and other farm animals using two main approaches, either at the atlantooccipital space, which is located at the back of the head, or at the lumbosacral space, situated in the lower back. However, collecting CSF at the atlantooccipital space carries a greater degree of risk because the needle needs to be placed very close to the brainstem, often requiring the animal to be under general anesthesia. On the other hand, obtaining CSF can sometimes be challenging regardless of the chosen site. Over the past 3 decades, advancements in veterinary medicine have led to the development of ultrasonographic techniques to assist in successful CSF collection in various animal species, including companion animals, cattle, small ruminants, and horses. Notably, a new ultrasound-guided technique has been described for horses, allowing CSF to be collected from the atlantoaxial space, which is located in the neck between the first and second vertebrae while the animals are standing and sedated. This method involves using ultrasound to visualize the subarachnoid space, where CSF is found, between these two vertebrae, and then collecting the sample using a lateral approach. While this technique has shown promise in horses, it had not yet been scientifically evaluated in South American camelids. Therefore, the researchers in this study set out with two main objectives. Firstly, they aimed to describe the ultrasound-guided atlantoaxial CSF collection technique in sedated South American camelids positioned in sternal recumbency, meaning lying on their chest. Secondly, they wanted to compare the technical difficulty of this new atlantoaxial technique with the more traditional lumbosacral technique, as well as to compare the characteristics of the CSF samples obtained using both methods. The researchers hypothesized that the atlantoaxial CSF collection technique would result in samples with less red blood cell contamination compared to the lumbosacral technique, but they also anticipated that the atlantoaxial technique might be more technically demanding to perform. To conduct their research, the investigators enrolled 8 clinically healthy adult South American camelids from a university teaching herd. The group consisted of 2 female llamas and 6 alpacas of varying sexes and reproductive statuses. The study employed a single-blinded, randomized, for-period crossover design. This meant that 2 veterinarians each performed both the atlantoaxial and lumbosacral CSF collection techniques, once on each of the 8 animals, and the order in which these collections occurred was randomized. One of the veterinarians was a resident in large animal internal medicine with prior experience in the lumbosacral technique but limited experience with the atlantoaxial method, while the other was a board-certified radiologist very skilled in ultrasound-guided procedures and highly experienced with the atlantoaxial CSF collection technique in horses. The sampling days were spread out over several weeks to allow sufficient time between procedures. Before each CSF collection, the animals were sedated using a mixture of anesthetic drugs. For the lumbosacral technique, the veterinarians identified the anatomical landmarks by palpating the dorsal pelvis and located the lumbosacral space just cranial to the tubersacral. The area was then clipped and prepared aseptically before a spinal needle was inserted perpendicularly to the vertebral column until a subtle resistance or a popping sensation was felt as the needle passed through the interarcuate ligament. Placement in the subarachnoid space was often indicated by a sudden movement of the tail, and if not, the stylet of the needle was periodically removed to check for CSF flow. If CSF flow was not readily apparent despite the operator believing they were in the correct space, the needle might be slightly repositioned. If blood was observed in the CSF, the fluid was briefly allowed to flow to see if the contamination cleared. For the atlantoaxial technique, after sedation and placement in sternal recumbency, the animal's neck was gently flexed laterally. The transverse process of the first cervical vertebra, C1, was palpated, and then an ultrasound probe was placed to visualize the accessible subarachnoid space and the spinal cord. The skin was prepared aseptically, and the ultrasound probe, covered in a sterile glove with transmission gel, was used to guide the insertion of the spinal needle. The needle tip was advanced axially into the subarachnoid space surrounding the spinal cord while being constantly visualized with ultrasound. Once the needle tip was confirmed to be in the correct location, the stylet was removed and CSF was collected. Similar to the lumbosacral technique, if CSF flow was not immediately evident, the needle might be slightly repositioned under ultrasound guidance. Blood contamination was managed in the same way as with the lumbosacral approach. Following collection, the CSF samples were promptly submitted to a clinical pathology laboratory for analysis. The samples were evaluated for color, clarity, total protein concentration, total nucleated cell count, and red blood cell count. A board-certified clinical pathologist, unaware of which technique was used for each sample, performed the analysis. The researchers also recorded the time taken for each collection, the number of attempts and needle repositioning events, any reactions from the animals, and the volume of CSF obtained. Statistical analyses were then performed to compare the two techniques. The results of this study indicated that CSF samples were successfully collected using both the atlantoaxial and lumbosacral techniques in all attempted collections, and no immediate complications were observed following either procedure. Most of the CSF samples appeared visually colorless and clear, with 63% being deemed unremarkable by the pathologist. Interestingly, contrary to the initial hypothesis, blood contamination was observed more frequently in samples collected using the atlantoaxial technique, with 44% of these samples showing blood contamination compared to only 19% of the lumbosacral samples. It is important to note that one animal had unusual CSF findings, including albuminocytological dissociation and lymphocytic pleocytosis, in samples collected via the lumbosacral approach on 2 separate occasions, and a markedly blood-contaminated atlantoaxial sample on a 3rd occasion, making reliable cytological interpretation impossible for that last sample. When comparing the cellular components and protein levels in the CSF, the median total nucleated cell counts and red blood cell counts did not differ significantly between the two techniques. Similarly, the median total protein concentration was also comparable between the atlantoaxial and lumbosacral methods. The researchers did observe a significant relationship between repeated sampling events and the total nucleated cell count, suggesting that serial CSF collections might influence this parameter. As expected, there were strong correlations between increased red blood cell counts and increased total nucleated cell counts and total protein concentrations, highlighting the impact of blood contamination on these CSF analytes. In terms of the feasibility and difficulty of sample collection, the study found no significant differences in the technical aspects between the atlantoaxial and lumbosacral techniques. The median number of attempts required for successful collection was 1 for both techniques, and the median number of needle repositioning events was 1 for atlantoaxial and 0 for lumbosacral. The median time taken for successful sample acquisition was 2.1 minutes for the atlantoaxial technique and 1.3 minutes for the lumbosacral technique, a difference that was not statistically significant. Animal reactions during the procedures were noted, with head twitches observed in 31% of animals during the atlantoaxial approach and tail swishes in 63% during the lumbosacral approach, but the frequency of these reactions did not differ significantly between the two methods. When the researchers compared the performance of the two operators, they found that the main technical aspects of CSF collection did not vary significantly between the novice and the experienced veterinarian. However, they did identify significant interactions between the operator and the sampling trial, as well as between the operator and the method, regarding the number of attempts required. This indicated that the less experienced operator required a higher number of attempts during certain CSF collection trials. Interestingly, the order in which the samples were collected throughout the study did not significantly affect the time, number of repositioning events, or attempts required for successful sample acquisition for either operator or method. The findings of the study provide valuable insights into the use of ultrasound-guided atlantoaxial CSF Centesis in South American camelids. Contrary to the initial hypothesis, this technique did not result in less blood contamination compared to the traditional lumbosacral method. The average number of attempts needed for the atlantoaxial technique in this study was comparable to findings in previous studies involving horses. The longest collection time and highest number of attempts for the atlantoaxial technique were associated with the novice operator during their second attempt, suggesting that operator experience plays a role in the efficiency of this novel technique. It is plausible that the inexperience of the operator, rather than specific anatomical challenges in that particular animal, was the primary factor. The average time to collect a sample using the atlantoaxial method in this study was similar to that reported in previous equine studies and consistent with another equine study. No significant difference was found in collection times between the atlantoaxial and lumbosacral techniques. While operator experience is crucial for any CSF collection technique, this study suggests that the ultrasound-guided atlantoaxial technique can be successfully learned by a veterinarian already proficient in at least one other CSF Centesis method. Despite the acquisition of technical skills, the researchers cautioned that the atlantoaxial technique might inherently carry a higher risk compared to the lumbosacral approach due to the proximity of the needle placement to the spinal cord. Interestingly, fewer South American camelids in this study showed noticeable reactions to the atlantoaxial Centesis compared to a prior study in horses. However, reaction rates can be influenced by the sedation and anesthesia protocols used, potentially explaining the differences observed across studies and species. The study also highlighted that the presence or absence of a tail swish during lumbosacral centesis in South American camelids is not always a reliable indicator of correct needle placement, emphasizing the importance of using other methods to confirm proper positioning. The study's finding that repeated CSF sampling within a 2-week interval may affect the total nucleated cell count aligns with observations in human studies, suggesting a potential inflammatory response within the central nervous system due to repeated procedures. Unlike some reports in horses that noted mild swelling or sensitivity after atlantoaxial centesis, the South American camelids in the study did not exhibit pain or swelling at either collection site. However, given that the ultrasound-guided atlantoaxial technique is relatively new in South American camelids, information on potential long-term or rare adverse effects is currently limited. The researchers emphasize that the decision to use the atlantoaxial technique should be based on various factors including the clinical circumstances, the suspected location of neurological disease, the operator's experience, the animal's temperament and anatomy, and the availability of the necessary equipment. The fact that the study did not find a reduction in blood contamination with the ultrasound-guided atlantoaxial technique as some previous studies in other large animals have reported suggests that factors such as operator experience, individual animal anatomy, and variations in vascular anatomy can all contribute to iatrogenic blood contamination. The researchers acknowledged that a limitation of their study was the relatively small number of animals involved, which was dictated by the availability of the university's teaching herd. A larger sample size would have provided greater statistical power. Additionally, the study was conducted on healthy animals, and further research is needed to evaluate the atlantoaxial technique in South American camelids with neurological disease. In conclusion, this study suggests that the ultrasound-guided atlantoaxial CSF centesis technique does not necessarily yield samples with less blood contamination compared to the standard lumbosacral technique in South American camelids. However, the two techniques were found to be comparable in terms of technical difficulty. The researchers proposed that the atlantoaxial technique could serve as a viable alternative for CSF collection in South American camelids, with the choice between techniques being guided by individual clinical circumstances, the suspected location of the neurological problem, the operator's skill, the animal's cooperation and physical characteristics, and the availability of the required equipment. Further research is warranted to assess the utility and safety of ultrasound-guided atlantoaxial CSF centesis in animals presenting with neurological disease. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.